doing justice to every role as a human being. It is not only your physical health, but your emotional, mental health. It is your spiritual health. It is your mental well-being. All of this has to be addressed.
But mental health is more prominent to our emotions and feelings. Hello everyone, I'm Tanisha from Moun Foundation and we are back with our interesting conversations around men's mental health. Today, we are honored to be joined by Dr. Abhijeet Wahegaonkar, a renowned hand and microvascular reconstructive surgeon with over 22 years of experience. He is also President-elect for Maharashtra Orthopedic Association. Thank you so much for joining us today, sir. Welcome to our podcast.
Thank you very much, Tanisha. This is indeed an honor and a privilege to be here with you on this podcast and talk about a very important aspect that we tend to neglect about men's mental health. Thank you.
Thank you so much, sir. So, let's begin with our podcast. What is the very first thought which comes to your mind when you hear about men's mental health?
I think the very first thought that comes to my mind about men's mental health is that this is so very neglected, so ill addressed, and so ill understood. It's interesting that your foundation is called as Moun Foundation, and you have undertaken a very important task of talking about men's mental health.
Yes.
And this is really commendable.
Thank you so much for that compliment. So, what do you think is the major problems men are facing currently and are silently struggling?
I think there are so many different issues that come to mind, but just to enumerate a few, I think it is depression, it is about peer pressure, financial constraints and financial burdens, looking after family, providing for the family. There are workplace tensions, maybe mental harassments, targets, deadlines, fatigue. There is anger, frustration, and there is no one to talk to about it.
Correct.
There is no way that you can come out with these emotions. Being a man, you're supposed to bear it, to live with it, to suffer silently. And to my mind, I think these are very common issues that really figure and that come to mind the first thing when you talk about men's mental health.
Correct. So, why do you think men still hesitate to talk openly about their problems?
Well, isn't it all about being a man? I think the concept of
Correct.
a man being a stoic and not voicing his issues and problems, being very resilient. And that is expected not only from the society, but also perhaps from the family, from his children. They look up to a man as a father who is strong and who is very resilient.
Correct.
And who does not suffer, perhaps, or who does not show that he is suffering. And I think suppression leads to even more complications and problems in terms of depression, anger, frustration, and God forbid, even suicidal tendencies, perhaps.
Yeah.
Yeah, and not being able to live up to the expectations at workplace, in the family. A man is always thinking, am I doing enough for my family?
Correct.
You look around, perhaps his neighbor's son or children are going to a better school than his children are, and then he is wondering why is it that he cannot do enough to make his children to go to a better school.
Correct.
Have a better car, have a better vehicle, have a good bank balance, and so on and so forth. So you get the drift. And then, unfortunately, if those targets are not met with, if those dreams are not fulfilled, men suffer. And then they are not able to voice it.
Correct.
I think in today's digital era, you have more of dependence on, digital platforms than real meaningful conversations with friends.
Correct.
Or real meaningful conversations with family, well-wishers. And then I think that all just piles up.
He's in constant turmoil of all these mixtures of expectations and dreams, reality. He's just struggling constantly throughout.
Very
But
true.
he just don't know where to find a way to get it all out
I
of
agree.
the system.
Yep.
So I think it's more of a constant framework of the society which is built up over the years of time, where we have made it so normalized that men not opening up, men not showing emotions, men not showing that he is in pain, he is struggling.
True.
And don't we think that we have normalized it to the point that nowadays when we look at the data, men has the higher data of leading to suicides or ending lives than women.
Very true. Very true. Perhaps that's a big epidemic
Correct.
that we are now facing. And unfortunately, it's only the tip of the epidemic that we are
Yes.
seeing.
Hmm.
And there is so much that is under surface.
Correct.
And we really need to address these issues
Issues.
and make a better society for ourselves.
Definitely. So, as a doctor, do you feel that men often ignore not just mental health but even physical health issues until they become very serious? And why is that so?
Oh, they truly do. And trust me, I am guilty of that as well.
Why do you think
And
that?
so, just to cite an example, I had elbow pain
Hmm.
and I knew what the problem is. I knew what the treatment is, but I just ignored it, thinking that, oh, it'll pass away, it will kind of, the pain will go away, and it's not too much of a problem. And then one fine day, while I was operating, the pain was so excruciating that I had to stop operating. So when I myself am guilty of this
Correct.
issue of neglecting my own physical health, and at times, surgeons have so much of stress, not only from the work pressure, long working hours,
Correct.
less sleep, uh, demands from your profession, and so on and so forth, right from your student days when you're supposed to study a lot, spend sleepless night, long nights studying, and then into the profession as well. So your mental health also suffers.
Correct.
And I have found myself becoming a little, kind of restless or angry at my own children when you are tired mentally and frustrated, and your children demand your time. You're not able to give your time to your children. And then I realized that this is now it should be. This is not how it should be.
This is
So
alarming.
and I can only imagine if you extrapolate this experience and magnify it or multiply it to the society, you can only imagine how much of a problem this really is.
Correct.
Day in, day out, we do see people who suffer from physical injuries, have mental problems. I always like to think that behind every broken hand or wrist is a human being with his own set of socioeconomical problems, emotional problems, perhaps mental problems. And behind that man is his family. So you can see how it translates
From
a physical injury causing emotional distress and mental agony, not only to the person who has suffered it.
correct.
And of course, the magnitude of the injury also kind of really makes a lot of difference and impact. To cite an example, so we see a lot of very unfortunate injuries called as brachial plexus injuries.
Okay.
So these are basically predominantly motorcycle and motor vehicle accidents, and the fall causes a paralysis of the entire leg. And unfortunately, the treatment and the outcomes of these injuries very seldom lead to a full recovery. So always there is going to be some kind of a disability. So imagine a young, active individual who's absolutely fine until this moment of time that he has an accident. He meets with the accident, realizes that his upper extremity is paralyzed, comes to us for counseling or for treatment. And then we have to tell him, look, despite all treatment, there still may be some residual problem. Imagine he has a wife and a small child. They're all listening to this. And I just have to look into that person's eyes and the family's eyes to realize what impact these people must be going through,
Going
the
through.
emotional trauma, the
Mm.
psychological stress.
Stress.
It's really very distressful, even
Mm.
to us as treating surgeons.
Correct. So I think that's where we see how physical health really, is physical health is connected to mental health
Very true.
always.
Absolutely.
But we always overlook the mental side, and we just see the physical sides because it's more prominently visible to our eyes. But mental health is more prominent to our emotions and feelings.
I'm sorry to interrupt you, but can I just also say that there is a corollary to what you just
Yes,
said,
yes.
that physical health equates to mental health.
Yes,
But I
definitely.
think mental health also
Hmm.
is responsible for good physical health. So,
Correct.
especially in today's world, we have children who are hooked on to games and cell phones and computers.
All the
They
time.
hold themselves in a room,
Hmm.
neglecting physical activity. When we were children, we only had outdoor sports.
Sports.
We used to go out and play. We used to be out in the open,
Socialize with
exactly,
friends.
physical exercises, outdoor play. But now we find that younger kids and children are hooked onto cell phones
Correct.
without realizing that physical health and neglecting their physical health.
Hmm.
Not only that, this itself is digital dependence, is not just dependence, it leads to digital addiction,
Correct.
leads to so much of temper tantrums when you take the digital device away from children. So I think this is a very important aspect that we tend to neglect and we tend to overlook. We have accepted that everyone should be pouring or should be looking at their cell phones. I go to restaurants and you see a group of friends who meet together. They just say hi, hello, and again they are hooked onto their cell phones.
Yeah.
Families go out to dinners, and then everyone is hooked on to
They
their
just
cell
order
phones.
the food and they're hooked onto the
We are
cell phone.
losing the art of conversation. We are losing the art of communication. We're losing an emotional connect. And I think that is a huge problem that we have to recognize and we have to address as well.
Absolutely. I think that's another pandemic we are looking, or we are ourselves inviting that, you come because we are the, reasons causing that.
I agree.
So you help patients regain movement and independence. How deeply can a physical injury impact a man's confidence and emotional well-being?
Imagine again a person who has lost a limb or a person who has had a paralysis of the limb, fingers being chopped off, hands getting crushed in a machine, or even, for example, there are parents who have a child who's born with, no thumb, no hand for that matter, a feeling of guilt, depression. For adults and elder people who have had either just a simple fracture, even a small finger injury, which keeps them away from what they're doing,
Correct.
is a huge emotional impact. Have you ever realized, Tanisha, that in today's world, when you ask me, let me ask you, Tanisha, hi, who are you? What would you say?
I'm a human being.
Wonderful. That's a very nice, I would say, answer. But if more often than not, if you ask people, who are you? I would say, I'm a doctor.
Yeah,
I'm an engineer. I'm a photographer. I'm a
Correct.
cinematographer. I'm a psychologist. Right?
Yeah.
We identify ourselves with who we are as professionals.
Professionals.
And when that professional title is taken away from, imagine I have an injury to the hand.
Correct.
I can't be a doctor for some time. I can't work. That entire thing translates into a loss of identity,
Correct.
albeit temporarily. But for a person who has lost his hand, it is snatching away his identity forever.
Correct.
Can you imagine the trauma that person has to go through?
Honestly, no.
Yeah,
I
right.
can't
The
imagine.
psychological. You are a psychologist, right? When you introduce yourself, the first thing you said, I've worked with Moun Foundation. But there is so much to your life than just working for Moun Foundation. To me, I am a father, I am a son, I am a husband. Besides being a doctor, I'm a friend. We are all neglecting those identities.
Correct. over
and giving
professional identity.
preference to our profession as our identity.
Correct.
And when the injury takes away your identity, either temporarily or permanently, it is going to cause a significant psychological impact. It is going to cause depression. It is going to cause frustration. It is like snatching away the reason that you are alive, or you are, it's taking away a purpose in life.
Absolutely.
So I think it's very profound. It's much more than meets the eye.
Correct. So moving forward, when a man suddenly loses strength or hand function after an accident, what psychological changes you have observed in him and his family?
I think the first impact that we see psychologically is that of shock and disbelief. Besides that, we see denial a lot of times, especially when people have, say, for example, just a minor ligament strain and they come to us and we tell them, well, this is going to need surgery. They are in denial that such a small injury or a seemingly small injury will require surgery, because they are afraid that it's going to take them away from their work. So shock, disbelief, denial, anger, frustration, fear, right? Or a lot of times the um, the concern as to, for example, if there is an expenditure that is involved with the treatment and they don't have the means to meet that expenditure.
Correct.
And they realize that this is important for them to get better and return to work. And then there is a lot of pressure psychologically, not only on the individual but the family, as to, especially, for example, poor farmers or laborers who come from the periphery and they need some treatment wherein some expenditure is involved. That expenditure to someone from the city may be insignificant, but for that individual it's humongous.
Correct.
How do I meet with that expenditure? How do I come up with the money to pay for my medical expenditure? Right? So it is such a potpourri of emotions.
Correct.
It's an emotional mess that the person is in. So obviously this translates to a lot of outcomes in terms of emotional stress, depression, anxiety, fear, whatever you want to call it. And it's really crazy.
So like you mentioned about expenditure, so medical bills are the greatest or the most, having that intensity of pressure on especially a man's mind, because we see as man's bread earners, and when it comes to him or his family, he will be always upfront about that it is my responsibility to pay the bills. And in India especially, lakhs and lakhs of medical bills, health insurance has taken over people's life, earning and fulfilling that bills. So what do you think is, when there is a accident or a huge expensive bill related to medical or hospital, so what kind of pressure or a man goes through just to put off or fulfill those bills?
Very true. I think, like I said at the get-go, the rabbit hole just gets deeper and deeper. And especially when people don't have insurance coverages, or when they are paying out of their pocket for medical expenditures, it's not easy. And I too have had to bear the brunt of this, because my father needed some medical care and attention, very big surgery for his heart, no kind of medical coverage or insurance, and we had to pay money upfront for the surgery. And I realized how difficult it is to come up with that amount at the drop of a hat. It's not easy. You're not prepared for it. Now, if you're suffering from illness or something, maybe you have some time to prepare, but when you have an injury, it happens in a matter of seconds. The whole scenario changes. And then you have to cough up that amount. It's not easy. And we have seen violence as a way of venting out that frustration and anger, right? People get violent, people get frustrated, people get annoyed But I think there are two sides to a coin. So
Hmm.
just to put things in perspective, India is a country where you have access to the best of care,
Hmm.
even super specialist care, at the drop of a hat for peanuts.
Hmm.
The same care is inaccessible in the Western Hemisphere, and you
Hmm.
cannot see a super specialist without references, and the waiting list is in months and years at times.
Correct.
To get an MRI done, it takes 6 months of waiting time in the NHS in the UK,
Hmm.
whereas here you have got MRI center next door where you can just go and get your MRI done.
Correct.
So there is a huge dichotomy. I
Hmm.
understand that. But at the same time, we should now prepare ourselves for any eventuality. Keep some funds aside
Side for
for
health.
our health,
Hmm.
not only for ourselves but for the family.
Correct.
But then coming back to the question from this philosophical aspect is, I do agree that an injury, and when you hear about the expenditures and people have to cough up that money or they have
Yeah.
to come up with that money, it is not easy. We
Hmm.
recognize this. And this is where doctors need to be compassionate, need to have empathy,
Hmm.
need to have the patience to talk to people, to help them
Correct.
understand. And I
Hmm.
think that might solve the problem.
Problem. Many men connect their identity with work and productivity, we already spoke about. But what happens mentally when an injury affects their ability to work or provide? Do they actually accept it, or it takes a lot of time for them to counsel themselves in order to get back to the work after they get cured?
Sure, I think we already just discussed that a little
Hmm.
while ago
Yes.
because, like I said, a lot of people identify themselves with their profession as to who they are.
Hmm.
You know, I'm a lawyer, I'm a doctor,
Yeah.
I'm a psychologist, I'm a photographer, what an engineer,
Hmm.
whatever it is. And this is who we become, I guess, and this is what we identify with it because our professions give us a purpose.
Hmm.
And when an injury takes that purpose away or it interferes with your purpose, and when I say purpose, it's a profession that we are talking about, it is but natural that
Hmm.
there is going to be a sense of fear. What if I lose my job?
Job.
Today we hear of so many layoffs,
Hmm.
especially in the IT profession.
Yeah.
So if there is an injury and that takes away my time from work, and then my boss gets someone else to do my job. Look at military professional,
Hmm.
military personnel for that matter. They have an injury and
Hmm.
then they are either demoted or they are kind of given, you know, their ability to perform goes away.
Yeah.
If you have engineers, whatever profession you are in, if you lose the sense of purpose, if you lose the purpose of life, there is going to be a huge psychological
Hmm.
impact, which is going to take a toll on your mental health. Um, and it is going to cause chaos in a person's life.
Person's
This
life.
is what we see, post traumatic stress disorder. So
Absolutely.
seldom
Hmm.
discussed.
Hmm.
People meet with accidents, they relive their trauma so
Hmm.
many times. People have nightmares,
Hmm.
they have bad dreams, they are in fear. People have given up driving once they have met with an accident,
Accident.
so on and so forth.
Hmm. Here we comes into the picture, psychologists, counselors, but we are rarely spoken about in majority of the families, because we, as I don't know about the outside of India, but in India especially, we are very less considered when it comes to mental health, because there is still that stigma that only if you are mad or you are psychic, then only you visit or seek professional help.
Very
Why
true.
is that so? You have met with an accident. You have to let go of the trauma, but it won't go at the uh, snitch of a time. You have to visit or seek professional help. But we still, somewhere or the other, we lag behind when it comes to going to psychiatrists or doctors or counselors, for a matter of fact, that You have to heal. So for healing, you need some professional help. Like you said, you mentioned about PTSD. Nobody talks about it because they don't know what it is actually about. It is not diagnosed, it is not assessed, but who will diagnose it? Who will assist it? We as a professionals, we have the power, or we have the knowledge to diagnose it. And once it is diagnosed, we just suggest either you take therapy or you don't, but it is crucial for your mental well-being and for your quality of life. But somewhere or the other it gets overshadowed that it's okay, it's fine, it's not that much of an importance. Why is that so?
It's I think I agree with you. I concur with you that this is this is a big problem. In our practice, we do have psychologists who help our patients with post-traumatic stress disorders, especially when people have lost limbs,
Yeah.
paralysis, bad injuries, and we do seek the help of psychologists and psychiatrists um, to help these patients. I think we first and foremost have to identify that patient care and well-being is a teamwork.
Yeah, absolutely.
It is not only about the treating doctor. It is about nurses,
Nurse.
your assistants, physiotherapists, psychiatrists, psychologists,
Family.
family physicians, so many things. It's a team that is brought into action or is called into action, and it has to be recognized.
Yeah.
And we've all heard that we can't see what the mind doesn't know. So I think the question of psychologists and psychiatrists not being a part of the trauma team is because this is a concept that's not taught well enough, is not discussed well enough, and treatment is relegated only to the treating doctor, the surgeon for that matter, perhaps more often than not. There are centers like ours, for example, wherein we recognize this, the importance of mental health. There are others as well, I'm sure, wherein this kind of a team approach is utilized.
Yeah.
It's just that we need to talk more about it. We need to create an awareness. We need to discuss this in medical conferences for that matter. And then I think it can be turned into a more organized teamwork.
System,
It can become a norm rather than the exception.
Exception, yeah. So it's more on the accepting side, rather awareness and acceptance side, rather than it's just for the matter of presence. It is there. Many people do sought professional help when it comes to mental health, but still it is in the on the way that it will be integrated into a proper normalized system. And it's, I think that more and more we talk about mental health, more and more we normalize, because even if we just get a headache or a normal fever, we do seek a professional doctor's help. So I think when, if you feel depressed or sad, or you are traumatized about an event which you seem that no, it is not normal for my emotional well-being, so we should normalize it to the point that professional help is at the tip of the fingers. And more we talk, more and more people seek help, and more mental health gets the recognition it should get.
Very true.
We have normalized using depression, anxiety, and suicide words in our everyday lives, but we have not normalized therapy. We have not normalized talking to, socializing, friends. Socializing for now has changed the definition completely. Socializing is partying, is posting pictures on Instagram. But what about, like you said, the art of communication, right? Speaking to that one friend, how are you? How is your life? Are you doing okay? Are you well?
Very true.
We don't ask these questions often.
Having meaningful conversations.
Yeah, exactly.
I would really want to say that silence is not strength.
Yeah.
Asking for help is not a sign of
Weakness. Yeah.
Knowing that you are not alone and there are people to help
Help
you
you.
is in itself a very wonderful thing. And there are people to help.
Yeah.
You just have to come out, talk. You
Talk.
have to ask for help.
Hmm.
You have to reach out.
Yeah.
And there are people who are willing to reach out to you. So I'm sure that such endeavors like the one we are conducting right now, these podcasts, the wonderful work that Mon is doing,
Yes, sir.
will help make a dent
Then.
in the society,
Hmm.
will help for sure normalize the issue of mental health
Yeah.
amongst men, and you know, just saying that it's a man's world,
World.
and then you are suffering in silence, trauma, agony, depression, whatever it is, can be addressed as much as physical health
Health.
is. And I'm sure this will go a long way.
Yes, yes, definitely, sir. So this is my personal curiosity that as a doctor, as a hand surgeon, and you solve complex situations and people's life, and it brings a lot of immense pressure, stress. So how do you really unwind your mental stress?
Great question. So, my fallback is my family. And every time I come home and I get a hug from my family, it just de-stresses me
De-stress.
completely. I think a social fabric is extremely important.
Yeah.
Friends, for that matter. Meeting and having friend circles outside your professional circles. Reading, I am a voracious reader, and especially also music for that matter. I love listening to music.
Amazing.
I love reading. I love reading philosophy, especially outings, be in nature. So, what I'm essentially trying to say is that understand that your profession is a part of your life,
Yeah.
it is not your life.
Life.
And you have to recognize this. And, like we say, a place for everything and everything in its place. As a doctor, I'm attending to my patients, but as a father, I need to be available and present for my children. As a
Correct.
husband, my wife, as a son, my parents, as a friend, my friend circle, so on. So we are playing so many roles. It's extremely important that we strike a balance in all these spheres.
Totally, yeah.
It is also my belief that a person who is content, is balanced, and is happy at the home front is a person who will be able to do justice to his profession, not vice versa. You know, if you're very good at your profession and your social and your family life is suffering, it's not going to lead to a happy outcome. And therefore, striking a balance in every walk of life, every sphere of life, kind of uh, doing justice to every role as a human being. It is not only your physical health, but your emotional, mental health. It is your spiritual health. It is your mental well-being. All of this has to be addressed.
Absolutely. So, do you think doctors and surgeons are expected to always stay strong, but they deal with so much stress and burnout in their profession?
I don't think it's just only doctors and surgeons. Everyone is expected to stay strong. I'm sure in the IT profession, when you have this humongous work pressures and deadlines and targets, you are expected to stay strong and continue working and doing your best no matter what. Look at manual workers. Look at, for example, engineers, whoever it is. I think today's world is so competitive that right from childhood, students are supposed to be strong. They are supposed to endure all the hardships.
Correct.
They are supposed to keep studying despite lack of sleep, for that matter. Look at young individuals who are doing either a manual work or desk jobs. So I think pretty much even doctors and surgeons are expected to. The only difference I would perhaps think that really matters is that in every other profession, more often than not, you're dealing with either machines
Mm.
or healthy human beings.
Correct.
A doctor's profession involves dealing with ill or injured human beings.
Mm.
Sometimes that injury may be devastating, sometimes that illness may be terminal,
Mm.
and that's where the entire difference lies.
Mm.
Talking to people and hearing about their illness and troubles over and over and over
Mm.
again,
Yeah.
I think does affect that individual's mental health
Mental
as a
health.
doctor.
Mm.
Or you know, dealing with injuries
Mm.
and not being able to do enough, that sense of I haven't perhaps done enough,
Done enough.
or the patient expectations are more than what can actually be achieved,
Mm.
and the frustration that stems on both sides from that lack of the expectations
Patient.
meeting up
Ah.
can be quite devastating.
Devastating. Yeah.
you know I do a surgery for that matter, and if my patient doesn't get the desired outcomes,
Mm.
I suffer as much as my patient
Patient
does.
does.
It's
Mm.
just that I cannot speak it out because I have to attend to the next patient.
Patient.
I cannot get too overly emotionally traumatized
Mm.
and depressed, because then I won't be able to do justice to
Just
the
to
next
the
patient.
patients. Yeah.
In fact, a distracted and a distracted surgeon is a dangerous surgeon
So,
because he might cause harm to the next patient he's dealing with.
mm.
And there are times, when I feel overly exhausted
Mm.
physically, emotionally, mentally.
Mentally.
And then I do what is best, and that's take a day off.
Mm.
Take time off, recharge yourself, rejuvenate yourself, and then get back to work.
Mm.
There is no denying that the work has to go on. This is where I guess good, healthy work culture, food habits, sleep, emotional balance,
Mm.
and a good work culture wherein you are working for happiness and you're working with your heart in your work
Mm.
matters the most.
Most. Yeah,
And
definitely.
that's how I think doctors and surgeons are more often than not.
Mm.
But every now and then, we see that there are incidences which are unpleasant. I'm sure you must be knowing that suicide rates are the highest amongst doctors.
Absolutely. Yeah.
And this is because they are also human beings.
Human
We are
beings.
human
Yeah.
beings. And sometimes things may be amiss,
Mm.
leading to these issues.
Correct. Absolutely. You mentor young doctors and medical students. What advice do you give young men about balancing ambition, health, and emotional well being?
Well, this is a very important question. We encourage our students and our mentees to be emotionally stable and strong, to have a very good work pattern in terms of good regular habits, good food, healthy food,
Mm.
emotionally connecting to friends and families,
Mm.
having a spiritual side to whatever it is that we do as doctors, having a sense of purpose which is balanced and well placed and not misplaced, avoiding substance abuse,
These, yeah.
and being mentally strong. I think emotional balance is a foundation
Correct.
on which your lives can be built. I think in today's world, we need to recognize that emotional quotient, EQ,
Yeah.
is much, much more important
Important.
than intelligence quotient or the
Absolutely.
IQ.
IQ.
So, and that is how our society is going to be better.
Mm.
Look at the road rage that we see today.
Yeah, it's
Look at
horrible.
the anger that
Yeah.
we see today. It is all because of an innate sense of fear,
Mm.
anger, frustration, workplace expectations. Perhaps your pay doesn't match the efforts that you're putting in,
Putting
so on and so forth. So, we really need to stabilize ourselves emotionally, mentally, have good physical health
in.
to be able to do justice to our work as professionals as well.
That's an amazing answer. So, what role do resilience and mindset play in recovering from physical incidents or injuries?
Great question. And I talk about this to almost every single patient. I tell them that a patient who is upbeat, who is emotionally stable, who takes charge of his mental health, does much better with a physical injury. And this is not something that I speak, it is an experience
Yeah,
over years together, not only mine,
absolutely.
but even my colleagues for that
Yeah.
matter. And vis-a-vis a person who is always depressed, suspicious, angry, whatever, negativity, and even a well done treatment plan will not have the same outcomes when your emotional stability is jeopardized,
Yeah, absolutely.
right? So people uh, who are positive, who are optimistic, mentally quite strong, and they have this feeling everything will be behind me. This too shall
It'll
pass.
pass. Yeah.
I find them to do much better than people who have a tinge of negativity. But I should also use this opportunity to say that it is the doctor's job, or perhaps his or her responsibility, to identify these subset of people and encourage them, pay more attention to them, communicate with them, talk to them, help them, refer them to psychologists and psychiatrists when the need arises.
Yeah,
Because this is how we're going to make a difference.
absolutely.
The positive and the optimistic people will take care of themselves no matter what.
What?
But it is the pessimistic and the negative attitude people that need more attention. They should not be discarded, they should not be neglected. So I think it is a job that has to be done, and done well.
Amazing. So, what message you would like to give all our audience, and especially men watching this interview?
I don't know if there is one message, because
There are
this
a lot
is,
of messages
yeah,
to be conveyed.
and I am no maestro. I'm not an authority. I'm also one amongst you. I'm also one just like you all. We all have a subset or set of issues and problems, uh, and we have to keep going. If you have a problem facing you, and that problem needs to be addressed, you have three options, in my
Okay.
humble opinion, and this is my own philosophy for that matter. Your first option is to stay optimistic, positive, and say, I'm going to do this no matter what, and I'm going to tide over this. This shall be behind me. Your second option is to crib and cry, to be depressed, to resort to unpleasant things such as substance abuse and negativity,
Yeah.
and suffer, and the problem is still there. It doesn't go away. And the third is to turn your back to it, and the issue is that there will be another problem when you turn your
Yeah.
back to it, right?
Escapism.
Escapism. So I would rather be the first one. I would rather use positivity. I would use the unknown or the unseen force and positivity of friends and family. Count my blessings. Be optimistic. Be grateful that I have another day to deal with things, and the strength, the moral courage, and the moral strength to do justice to this life. I'm not sure many people will understand Marathi, but there is a beautiful song in Marathi which goes like, "Ya जगण्यावर या जन्मावर शतदा प्रेम करावे."
Okay.
Essentially means that you should love this life, and you should love this uh, birth a million times over, because you don't know about what happens next. This is your opportunity, this is your chance. So stay strong, stay healthy, stay optimistic, stay positive. Silence is not strength. When needed, ask for help. There are people to help you recognize that, and God bless.
Thank you so much.
Thank you.
That was an amazing set of
Appreciate it.
answers, and I think many of us, even me, have learned so much from you so
Thank you.
far, and definitely our audience will somewhere or the other relate and, like you said, make a dent in their life. Indent as in change, positive change, and looking forward. Thank you so much, sir, for being on our podcast today.